a lot of patients that have been waiting a long time to get a diagnosis, and they've seen all different types of providers, and they may have either delayed getting a diagnosis on their own, or they just didn't get right answers or weren't seeking the right care. But by finding the answer early on, we can get a more complete and more efficient recovery. Those of us at Orlando Health that do the nerve testing have a lot of experience dealing with all these different areas, from something very simple like carpal tunnel syndrome, a pinched nerve at the wrist, to more complicated or more extreme types of nerve problems, from maybe traumatic situations, multiple trauma, or fractures, dislocations, things like that. So if someone has numbness, tingling, pain that's in a nerve pattern, maybe shooting pain down an extremity, burning, tingling, or weakness of extremities that's not explained by something obvious, musculoskeletal or orthopedic, we start to think that there's a nerve problem there, and we need to zero in on where it is and how bad it is so it can be treated. And so therefore we do the EMG and NCV test together at the same time to diagnose that. EMGs really stands for electromyography, which is a diagnostic test using the muscles to tell us how the nerves are working, where a needle is inserted in a muscle and we interpret the signals from that, and it tells us how that muscle's nerve is working. And NCV testing is a different type of test, using, on the surface, electrically stimulating the nerve along the extremity and watching how fast the signals go. And then that's also used to diagnose and localize nerve problems also. Nerves have a time clock that's basically ticking. When there's nerve damage, if you let it progress and if you allow something to get advanced and out of control, sometimes the treatment options are very, very limited. Nerves can heal, especially in the peripheral nerves that I'm talking about that we're testing with EMG and NCV testing. They have an amazing capacity to heal, especially if you catch the problem early and diagnose it correctly. We modify every test to every patient's needs. We'll take our time, we'll make you as comfortable as we can for the test, and it's better just to get it checked out early on. The earlier you diagnose it and diagnose it correctly, the better care you're going to get, and the more direct care, and actually less care. You need less care when it's an earlier problem and can possibly avoid surgery if you do it early on and get it answered correctly.